How does a colposcopy diagnose cervical intraepithelial neoplasia, CIN? Imagine a tiny camera that helps doctors see inside your cervix in great detail. That's what a colposcopy does. It's a special exam used to find abnormal areas that might be precancerous. Usually, it's done after a pap smear or HPV test shows something unusual. The goal is to look closely at the surface of the cervix to spot early signs of changes called cervical intraepithelial neoplasia, or CIN. During the procedure, the doctor will position you comfortably and insert a speculum to gently open the vagina. They then place a colposcope, which is a binocular microscope with a bright light, near your cervix. This device doesn't touch you but allows the doctor to see your cervix on a screen with high magnification. First, they might rinse the cervix with a saline solution to get a clear view. Then they apply a dilute acetic acid solution, similar to vinegar, which causes abnormal cells to turn white. This whitening, called acetohyrening, helps identify areas that might be CIN. The stronger and longer the whitening lasts, the more likely it is that the tissue is abnormal or high-grade. Next, the doctor applies Lugol's iodine, which stains normal cells brown because they contain glycogen. Abnormal cells, lacking glycogen, don't stain well and appear yellow or unstained. These color changes highlight suspicious spots. Based on what they see, the doctor can decide where to take small tissue samples called biopsies. These samples are sent to a lab for detailed examination under a microscope, which confirms whether CIN is present and how severe it might be. A key part of the process is examining the transformation zone, which is where the outer and inner parts of the cervix meet. This is the most common site for CIN to develop. Ensuring the entire zone is visible helps the doctor make an accurate diagnosis. The results from the biopsy tell whether the abnormal cells are low-grade, meaning they might go away on their own, or high-grade, which needs treatment to prevent progression to cancer. For example, CIN1 is usually monitored, while CIN2 or 3 often requires removal or other procedures. It's important to note that sometimes, especially in women after menopause, visualization can be tricky. Doctors might suggest using estrogen creams to improve the view. Overall, a colposcopy is a safe, effective way to detect early cervical changes. It helps catch problems early and guides appropriate treatment, playing a vital role in preventing cervical cancer. If you're scheduled for a colposcopy, remember to discuss any concerns with your healthcare provider and follow their advice for the best outcome.